Hi everyone, it's Dr. Lisa Gasson with our next installment of our reviews of research on child development. And today we're going to take a look at the question, which cognitive functions are compromised in children and teens who are depressed? An interesting question. We know that cognitive dysfunction comes along with depression for many adults. The question becomes, is that the same case with children and teens? And in order to try and answer this question, we're going to look at a 2015 meta-analysis by Dr. Stephanie Wagner and her colleagues. She is out of a university in Mainz. I hope I'm saying that right, Germany. And she and her colleagues report on a combination of 17 studies that involved children that ranged in age from 9 to about 15. The average age was about 13 and a half years. And throughout the study, they are comparing children who have a diagnosis of depression with kids who don't have a diagnosis of depression on many different cognitive functions. Let's see what they found. Okay, not surprisingly perhaps, they did find pretty consistently that young people with depression perform worse on a variety of cognitive skills. One that I'm not going to talk about in detail but might be of interest is they even found lower IQs among those who have a depression diagnosis. It's unclear what that means, of course, whether or not some of these other cognitive skill problems are contributing to IQ scores being lower or whether something else is going on. Uh, of all the cognitive skills they assessed, which is probably close to a dozen, I think, only one of them did not show a difference. So let me talk briefly about some of the skills that did show a difference. Okay, first of all, they found that young people with a depression diagnosis had poorer working memories, so they were slower in their thinking, could hold less information in their minds at any particular time. They were worse in verbal fluency, which has to do with how quickly you can produce spoken language. And of course, I think that has implications for talk therapy. If we're doing talk therapy with children who are depressed, will they really be able to engage like they might if we were using something a little bit more active and or nonverbal, such as play therapy? Something to think about. They were also lower in the ability to cognitively inhibit themselves, in other words, the ability to suppress some kind of response that's habitual rather than produce a new response that was more appropriate. And also cognitive shifting, which is kind of similar, the idea of switching trains of thought when needed. And I think that could be an important issue in terms of trying to break the cycle of, say, rumination or help a child, if you're using cognitive behavioral therapy, to shift to more healthy forms of thinking. Can be particularly difficult. They were more deficient in planning skills, the ability to sustain attention, and also simply in short and long-term recall. This latter item, combined with the issue of verbal fluency, also, I think, at least for me, highlights the importance of being sure to give them enough time to respond. It may take longer for, especially verbal responses, but perhaps any kind of response to come forth. Of course, as professionals, we have to rule out the possibility that something like a sleep disturbance or a medical condition or medication might be causing these things. Assuming that those things are not causally related, I think these results show us that cognitive intervention can be an important part of depression treatment. This is only correlational data. It doesn't necessarily prove that these deficits are causing the depression, but it opens the possibility that working with the cognitive system may be a part of healing from depression. In addition, it may be that some of the other cognitive problems with depression are causing some of these issues. The authors, Dr. Wagner and her colleagues, review a little bit of the information on rumination and how that can influence the rest of the cognitive system, influence it poorly. And so helping to quell the rumination that people with depression experience may be an important part of helping these other cognitive skills bounce back. That's it for today. I've enjoyed talking with you, and I'll look forward to seeing you again next time.